All right, good afternoon, everyone. It's 2 o'clock and it's time to start today's briefing. Joining us today, we have Milwaukee County Executive David Crowley, Milwaukee Mayor Tom Barrett, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services for the Milwaukee County Office of Emergency Management, and Marlena Jackson, Interim Commissioner of the Milwaukee Health Department. County Executive Crowley, you're up first.
Well, thank you so much, Sydney. First and foremost, I want to say Happy New Year to everyone on the Zoom call and watching. I hope you were able to ring in the 2021 New Year with those you love, those that mean as much to you as possible. But hopefully, whether that was virtual or in person, you had a good chance to spend some time with them. But when you think about this pandemic, and I think it's safe to say that 2020 didn't turn out how any of us really expected. But I would say we have reasons to be hopeful as we continue moving into 2021. And we're seeing more of our healthcare workers getting vaccinated right now. And planning is underway for further phases of distribution. And I'm starting the new year with optimism, especially knowing that progress is being made right here in Milwaukee County, that there is light at the end of the tunnel. And I say that there is some light because just because we are in a new year does not mean that COVID-19 virus is gone. And so we have to remain vigilant in our efforts to minimize the spread of COVID. So that means that we have to continue to wash our hands, watch our distance, and continue to wear a mask, because this is critical, not only to protect ourselves, but our families and our loved ones and our friends. And while I and others celebrate the fact that the vaccinations is underway, I know we still have a long road ahead of us. So planning a large-scale vaccination like this is a huge undertaking. Vaccine manufacturers, vaccinators, state and local governments are working tirelessly to get these vaccines to those who want them. Everyone who plays a role in this vaccination effort wants this to happen as quickly as possible, but we all recognize that planning takes time and we all need to be patient. So while I'm entering 2021 excited and hopeful, I'm also realistic about the time it will take. And I know that the time it's going to take to get the vaccinations out there. And I know that we still have a long way to go. But I'm going to continue sharing good news when we get them. And today we have some good news to share about the progress that we're achieving. And we're achieving our county's goal to ensuring that our more than 4,000 employees have access to the vaccine as soon as it's available. These employees really provide essential services that our community relies on constantly. And I'm glad to share that more than 300 COVID vaccines are being distributed to the County Office of Emergency Management EMS providers. The Milwaukee County Behavioral Health Division has already received some vaccines, and the county is extremely grateful to receive these doses and are hopeful that we can quickly move through phase 1A, to move on to the others in need. So county EMS workers, our behavioral health providers, they willingly take on physical and mental burdens to take care of members of our community. And with the distribution of the vaccine, I'm hopeful that soon the burden of possible COVID exposure and infection will be less of a concern. And so with that, I would like to hand it over to Mayor Barrett.
Well, thank you very much, County Executive Crowley. And I love hearing your optimism for 2021. I think we all can agree that we are happy 2020 is gone. We've turned the page. We've got a new year, and let's be optimistic as we look forward as to how we navigate our way out of this pandemic. So I hope everyone had a safe and happy holiday season. But with the new year and the approved vaccines comes a newfound hope that this pandemic will see its end in the near future. And as the county executive said, everyone at the state level, at the local level is doing everything they can to make sure that we're taking the steps necessary to obtain these vaccinations and then to set up the distribution chain so that they can be distributed as quickly as we can. Although we must continue our physical distancing measures at this time, I think we can all see that there is a light. Maybe it's way down at the end of the tunnel, but we can see a light at the end of the tunnel, because this vaccine means an end to the cycle of fear and uncertainty for people across the globe, and the promise of a return to some sense of normalcy. So I hope when it becomes available on a widespread scale, that everyone will take advantage of it. I know that there are some people who have reservations, but I think the fact that you're seeing so many of the leaders, the scientific leaders, the healthcare leaders taking this vaccination tells you that it's something that has been tested in a very, very, very short period, but it has been tested exhaustively. So here's where we are, and I'm very, very pleased that the county has received its allocation. Our request is in at the state. As recently as the last hour, half hour, we've been in direct contact with the state to try to expedite the delivery of the vaccinations to the city of Milwaukee. So in real time, we are doing what's necessary to be ready as soon as the vaccine is received. We're working on the venue over at the Wisconsin Center. We've been in contact with the firefighters, with our health department employees, so that they can get the training that is necessary. We're working with the Department of Public Works so that it can move the refrigeration necessary to the Wisconsin Center, because we anticipate that the allocation we get is going to be a Pfizer allocation. And so we want to make sure that we've got the right refrigeration or freezer, I should say, to handle that. So all of that is happening in real time. And I'm hoping that it's days rather than weeks when we will see this delivery occur here in Milwaukee. If I had my druthers, it would be here by the end of this week, and we're still working in hopes that that can be a reality. I can't make that promise, but I can promise you we're going to do everything we can to get it here as quickly as possible. And the reason for that is that I feel a sense of urgency to vaccinate our residents. As the county executive said, we start with the 1A group, which are the healthcare workers, the people who are in direct contact, excuse me, with the emergency care. For us, that means our firefighters, all of our firefighters, our emergency medical people, people in the health department, people who are working in our clinics. Those are the groups that are the first ones that will be receiving it. And we're committed to ensuring a smooth and well-organized process, which our residents deserve. I also want to take a quick moment to talk about testing updates as of Monday. I think the biggest change, if I'm not mistaken, is it's no longer Miller Park, it's now American Family Field. And at that location, we tested 1,555 yesterday. At the Northwest Health Center, we tested 465. At the Southside Health Center, we tested 306. So already this week, we've tested 2,300. Dr. Weston will talk about the positivity rate. That's a concern as we see what those numbers are. But I'm pleased to see people are getting tested. Again, if you're showing the symptoms coming out of this holiday season, please make sure that you get tested. So with that, I'm going to turn it over to Dr. Weston and thank him as well as the county executive for their leadership.
All right, thank you, Mr. Mayor. Good afternoon and Happy New Year. First to our numbers, we had 86,142 confirmed cases of COVID-19 in our community today, and 898 individuals who have died in Milwaukee County. And soon I hope to add to that report our vaccination numbers as well. As a state, as well as locally, we're starting to see a bit of a shift to our cycle of COVID. Our percent positivity is rising a bit, as are our case numbers. And this is the cycle that we've been seeing, with declining numbers leading to a decrease in individual precautions and a resultant rise in disease burden. We've been seeing this throughout the pandemic, but as we've seen, we can control it. By continuing our vigilance and our masking and our physical distancing, we've shown that we as a community can control the spread of disease. And part of controlling that spread of disease is rapid vaccination of our population, starting with that phase 1A grouping of healthcare providers, EMS personnel, and those in long-term care facilities. There's been a lot of attention lately on our EMS providers in particular, and I'm happy to say that, as the county executive mentioned, the Milwaukee County Office of Emergency Management received vaccine doses yesterday, and have several of our health departments, and EMS providers are being vaccinated right now as we speak. I wanted to talk a bit today, though, about vaccine hesitancy, those who may be apprehensive to receive the newly created and approved vaccine. Due to my work in the emergency department, I was honored and privileged to receive my first dose of the vaccination on December 18th. And I'll be receiving my second dose, my second shot, this Friday afternoon. And when I personally considered whether to receive that vaccine, I did as anyone does when making a medical decision, or really any rational decision for that matter, and considered the pros and cons, the benefits as well as the risks of vaccination versus the potential alternative, getting infected with COVID. So the benefit of the vaccine certainly is immunity, likely long-term protection from illness from the COVID virus. And likewise, the one benefit from COVID infection is possibly also immunity, though it appears to be quite variable immunity when you're infected rather than vaccinated. In some cases, that immunity from infection may not be very strong and may not last very long. And then we have to consider the risks. So when it comes to the vaccine, we've had tens of thousands of people vaccinated, with the response to the reactions very carefully monitored and tabulated in the trials to study the vaccine. And the most common effect certainly was a sore arm. I had a bit of a sore arm. Less common was fatigue, headaches, muscle aches, and much more rarely fever or vomiting. No one, not one person, died from receiving the vaccine. And then we consider the risks from being infected from the COVID virus. Illness is typical, and while admittedly likely mild in young people, it can be quite severe for those who are older and those with comorbidities. About 4 to 5% now of people who get COVID end up being hospitalized, and about 1 in 100, 1% of those infected will die. Those are the short-term effects, but you also have to consider the long-term effects of a COVID infection. The more mild long-term effects are fatigue, cough, chest pain, headaches, oftentimes a loss of taste and smell, and these can go on for quite a while. It's been found that 1 in 3 people with COVID who were surveyed 2, 3, or 4 weeks out from infection still had persistent symptoms. And even among healthy young people, 18 to 34-year-olds with no medical conditions, 1 in 5, fully 20%, have had persistent long-term symptoms from COVID-19. And then, of course, there's the more serious long-term effects that we've seen with COVID but are still learning about. These include blood clots, strokes, and long-term damage to the heart and the kidneys, as well as many others that we're still finding out. And then there's the true unknowns. The vaccine is new, but has been carefully designed and rigorously tested to be limited to really perform its designed actions. It goes into our body, it creates antibodies, and then it degrades, it goes away. With the COVID virus, when you're infected, it's a truly novel virus. We frankly don't know what may occur long-term to those who were infected. So when I considered these pros and cons, these risks and benefits, and when my colleagues in the emergency department and in the ICU, who truly see the disastrous effects of this pandemic, both on individuals as well as families, when we considered the risks and the benefits, the choice was clear. We received the vaccine. And when it's your chance to receive it, whether you're a doctor, a nurse, a medical assistant, a paramedic, a teacher, a police officer, whether you're old, young, Black, white, Hispanic, healthy, unhealthy, no matter who you are, I hope that you come to the same decision for yourself, for your family, and for your community. Thank you very much. Stay safe, and I'll hand it to Commissioner Jackson.
Thank you, Dr. Weston. Happy New Year, everyone. I wish that we were coming to you all with a new message, or that I was coming to you with a new message on this new year. But my message first and foremost is the same as it relates to the steps that we need to take and not forget around COVID vaccine and mitigation that you can do, each of us can do to slow the spread. And those have already been said many times, but I'm going to share them again as the start of the new year. So make sure that you're washing your hands. Make sure that you're wearing your mask. Make sure that you're washing your distance. And if you have symptoms, if you have been around individuals who have tested positive for COVID-19, please go get tested. Our testing sites are open and available for testing. With that, also wanted to share that it is important to do those steps because as we move into the vaccine space, this process is going to be long. And we know, and we are hearing about different variations and different mutations of COVID-19. And so as I think there have already we know that those variations have already hit the United States, and it's absolutely possible, and I think realistic to think at some point they will be here in southeastern Wisconsin. And so the steps that we follow to make sure that we don't get sick in the first place around washing your hands, washing your distance, is really important. I think it's also important for me to share that what we do notice many times, and I'm sure Dr. Weston in the emergency department can attest, we see individuals that want to maybe do one or the other. So I'm going to wear my mask, but I'm going to still be in a crowd of people. Or I might decide to social distance, but I don't need to wear a mask. So know that each of those steps are layered approaches, and the best defense to that is to have all of those steps at the same time. Also, if you're able to stay home, we ask that you continue to do that at this time. It's still safer to stay home. When we look at our case positivity rates for the city of Milwaukee, we also see a creeping up of numbers and positivity rates. So it's something that we have to watch. We don't want to be in a space where we are having another spike, which we typically see after holidays. And if we are there, again, we know that these steps, basic steps, are very, very important. I want to take just a minute to talk about our overall vaccine planning as it relates to the city of Milwaukee. So as has already been shared, we're proceeding with our vaccine preparation with a sense of urgency. I think everyone feels the need to make sure that we get our vaccine into the arms of individuals as soon as possible. The health department and the work that we're doing is really is a part of a larger piece of pie that includes healthcare systems. It includes pharmacies. It includes the state health department. It includes the county work. It includes a variety of other healthcare partners, all needing to coordinate who, what, and when, where people get the vaccine and people give the vaccine. It is a monumental effort and it's historic. It has not been done here in the state. It has not been done in our country before. So as we move forward, we are working on logistics as it relates to getting vaccines, again, into individuals who need them and who want them. That entails planning for vaccination sites. Those sites have to accommodate not just space for vaccines, but it has to include registration space to give the actual vaccination, space to have observation. It also means that we have to get the right personnel in place. We also have to make sure that we have the right supplies on hand. So there are many, many variables that go into how we're going to get vaccinated, or how people get vaccinated, and how we do that in a really safe and organized manner. That is the work that we want to do, is make sure that it is safe and make sure that it is organized. We are getting lots of questions, and I think many, many people want to know, when will I get my vaccine? Where will I be in the line? Where will I be in the process? And what I can share is that we are going to get the vaccine into people's arms and into the first responders as soon as possible. We're working with lots of partners to ensure that that distribution is prioritized and fair and most effective. We also are making sure that we follow the prioritization guidelines that are laid out by our national partners and our national best practice organizations. Know that this effort of vaccination will be long-term and ongoing. And it's also important to note that the Milwaukee Health Department is committed to vaccinations throughout the entire process. And while right now we are looking and focusing on Group 1A, which is our healthcare providers and our EMS workers, it also means that we are committed to our first responder group. We are committed to vaccinating our essential worker group. We are committed to vaccinating our individuals who are older or who might have ongoing health conditions. And then, of course, we are committed to vaccinating the general public when that time comes. So know that our work is long-term, but we are here, we are committed and working hard. And with that, I will turn it over to Sydney.
Thank you, Commissioner Jackson. Our first question comes from Patrick Palantonio at WISN 12 for Commissioner Jackson. How long do you expect the vaccination process to last, and what is the target date to get shots in the arms of the general public?
So we don't have a target date of when the general public will get the vaccine. But what we can tell you is that we are looking for to have our clinics up and running for our 1A group as early as next week. And so that's the work that we're focused on now. Again, this process will be months long. So I would not be surprised if we are into May and June before and when we get to the general public. It's a long process. There are hundreds of thousands of individuals across the country that need to be vaccinated.
Our next question is from Joyce Garbasiak at WISN 12. Other health departments and communities have enlisted drive-through vaccination centers and online registration. Are you considering this? What other options are you thinking of to do mass vaccination?
So I can share that that is an option that we did consider, but right now we want to make sure that we're focusing on space, just based off of weatherization and also being able to observe individuals. The COVID vaccine, unlike some other vaccines, there is a required or necessary 15 or 30-minute window of time where you have to observe individuals who just received the shot. And so we want to make sure that we're doing that in a space that's open and wide enough to be able to truly observe. And so at this point, we don't think that the drive-through setup is really conducive to that. So we're working on a one-site location as kind of a main hub. And then we look to have individual strike teams to be able to go out once we're ready to do that part of it.
Our next question, also from Patrick Palantonio for Mayor Barrett. What is the vaccine allotment the city of Milwaukee is requesting from the state, and is it strictly for people in the 1A category?
I think the number is 800, if I'm not mistaken, Commissioner. It's 800 we're requesting this week, and it is for the 1A category. We're still very much in the 1A category. So that means, as the Commissioner said, that means our health department people, and it also means our EMS people primarily. Those are the ones that are in the 1A classification.
Our next question is from Sari Lusk at the Milwaukee Business Journal for Commissioner Jackson. The city's current order is scheduled to expire soon. Has it achieved the results you wanted to see? Based on current trends, what is your plan for when the order expires? Will you revert back to the previous order or implement new rules?
So I think it's a bit early to give that answer as it relates to did it yield the response that we want? We're still watching those numbers as it relates to the Christmas and New Year's holiday. So we will continue to watch those numbers, and we'll adjust the orders as that information comes in. I would share that our hope and our goal is that we would be able to go back into 4.2 on the 15th.
Next question is from Joyce Garbasiak at WISN for Mayor Barrett. What do you say to critics who contend these vaccination plans should be farther along by now, knowing the vaccine was expected by the end of 2020?
My response would be that we got approved by the state on December 28th. That was the day of approval. We had hoped to be able to submit our request for vaccinations, but the timing was such that the portal would only allow it to go in yesterday. And so that's when the allocation was made. And what I have said, and I've had this conversation with the commissioner, with the fire chief, we're going to do everything we can to expedite that. So that's why I say we've been in contact with the state to see whether we can get it here quicker than early next week. And if we do, I want us to be prepared to do it as soon as we get it. So our goal is to get it out as quickly as we get it. And as soon as we get that allocation, I want it to start going into people's arms.
I think our most recent question in chat was just answered. Any other questions from media? Seeing there are no additional questions in chat, I believe we can wrap up for the day. Oh, one question just came in under the wire. Patrick from Channel 12. Dr. Weston, there are reports healthcare workers in other parts of the country prioritizing care due to crowded hospitals. How close are we to seeing something like that here?
So in Milwaukee County and in the state over the last month, certainly the last few weeks, we've been doing fairly well. Looking at numbers, we've been driving down our percent positivity. and our hospital capacity numbers have been going down as well. Now, concerningly, over the last few days, we're starting to see a little bit of an uptick again. So we'll have to keep a very close eye on that. But at this point, our hospitals are doing well and keeping up with any capacity issues.
Any additional questions from media? Please place them into chat. Seeing none, we can wrap up. Every time I wrap up. From Joyce at Channel 12, the state released vaccine levels. About 181,000 are here waiting to be used. Why are they not being used at this point?
Well, again, what I can say is that we're working with the state directly to get them here. And as soon as we get them here, we're going to start distributing them. And I see the county executive coming on. They are able to do that right now. And I think that's great.
Again, I think at the end of the day, we just are asking people to stay patient. You know, this is going to take a long time for us to gather. We are in the planning process, is not just here locally, but also with the state. And so this is really about us just making sure that we be patient. We have never rolled out anything this large of a scale from my knowledge. And so, again, we just want people to be patient.
And I would add to that, when we do receive vaccine, we're trying to use it as quickly as possible to get as many people in that 1A group vaccinated. The hospitals have been doing that. As soon as they receive vaccine, they're gearing up, they're getting that vaccine into arms. And same with Milwaukee County, when the Office of Emergency Management yesterday received 300 doses. Today, we're putting vaccines into arms of EMS workers.
Question for Dr. Weston. Can you elaborate on theories that vaccine doses should be split or longer lag times between the first and second doses?
Sure. So there's been two theories that have been talked about. One is separating out the time between the two doses. And the second one is separating out individual doses into smaller amounts per person. The intent with both of those is to vaccinate more people and just get the vaccine out to more people and start building that immune response. I think it's yet to be determined whether either of those is effective. The vaccine's been FDA approved as intended, which is to get a full dose up front and then to get another full dose. This is for the Moderna and the Pfizer, whether it's 4 weeks for Moderna, 3 weeks for Pfizer later. And so that's what's been FDA approved right now. That's what we're sticking with. And we'll continue to follow the evidence and see where it leads.
Our next question is from Hannah Jewell. What is being done to detect the new strain of coronavirus?
So that's a state level question. The state continues to evaluate and monitor the different strains of the virus.
Any further questions from the media for our panelists? All right, we'll wrap up for today and we'll be back here again on Thursday. Thanks everyone for joining us. Have a good afternoon.
Thank you all.
Have a good one. Thank you. New Year.
Thank you.